as many of you know, and for those of you who have been following us for several years now, Medicine X Ed is our conference dedicated to the future of medical education, with a focus on caregivers, patients, students themselves, the often underheard voices in medical education as drivers of innovation. So I'm so honored to welcome you here to our second convening. It's our conference that's made possible with funding through your registration fees and from our delegates and our staff and administrative support from the Stanford University Department of Anesthesiology. And so I want to thank our department and also a grant from the Patient-Centered Outcomes Research Institute. I also want to thank the Dean's Office of the School of Medicine here at Stanford, who helps us bring the best of Stanford and the School of Medicine to the Worldwide Medicine X Conference community twice a year. So please help me give a round of applause to our sponsors. Thank you so much. So I thought I'd start my talk off today by telling you a few stories. So this picture was taken in 1969, and it's of an exchange student who just arrived from Hong Kong. And she was born in Shanghai and grew up one of 6 children in Hong Kong. And so if her face seems somewhat apprehensive in this photo, I imagine it's because at the time very few women were venturing from the Far East to America for their education. But she wanted to become a pharmacist and to seek advanced training in the pharmaceutical sciences. And she couldn't really do that at the time in Hong Kong. So that exchange student was my mom, and here she is in this picture. She's receiving her pharmacy degree from the University of Wisconsin. So I'm telling you this story for a reason. As a first-generation American, growing up in the Midwest, where nobody else around you looks like you, role models matter. Mentorship matters. And so I may not remember the moment that is captured in this photo, but it's very much a part of my Genesis story. It's a huge part of why I'm standing here on this stage today. But my story isn't the only one that you will hear at Medicine X this weekend. Subhashri Nayak is a second-year medical student at the University of Maryland School of Medicine. The daughter of a community physician who lives in Baltimore, she is working to engage medical student and LGBT communities to address healthcare disparities at her school. Subhashri is one of our Medicine X student leadership scholars who will share her story on this stage too this weekend. And Amanda Briegel. Amanda is a gynecologic oncology specialist from Oregon Health Sciences University. And she finished her fellowship training at M.D. Anderson Cancer Center. And later today, she'll share her story of navigating Native American identity and physician identity and the importance of mentorship in medical education. Now, what unites these stories are the teachable moments they provide. Stories help us remember why we do the work we do, and stories cut to the heart of who we are at Medicine X. And when we share our own stories, we give ourselves an opportunity to build trust in each other and ourselves. So look around you. There are 350 more stories in this room today. So my first call to action to all of you here in this room, patients, caregivers, students, educators, clinicians, technologists, please trust in each other to take that wall down between your professional selves and your personal selves and share your stories with each other this weekend. because stories have the power to teach others. And as you will see at Medicine X this weekend, listening to and telling those stories can be a healing experience. So this is where I work at Stanford. My job is a professor of anesthesiology. I see my role in medicine is to shepherd patients through some of the most vulnerable moments of their lives as they journey from consciousness to unconsciousness, from incision to closure, from wound to repair, from sickness to health. At Stanford, we aim to reverse disease through surgery, some diseases, often very advanced surgery. We do this as safely as possible for our patients with the help of a lot of very smart people and a few advanced technologies. And we often use technologies and techniques that we developed here at Stanford, such as, like the cyberknife surgery for brain tumors and advanced robotic techniques that we use for advanced cancer surgeries. And anesthesiologists, we prepare patients for these procedures. We're the voice of the patient and their champion when they are asleep. And we continue their care until they're safely through the surgery and they're in the recovery room. And we're the last person they see before they go to sleep, and the first person they see when they wake up. So I think of my role as a shepherd, but I'm also part of a team. And we work in concert with the patient along their journey, and it's a great privilege. So my second call to action to you today is this. I ask that we think of ourselves as shepherds and collaborators and team members. Our role being to guide each other from one stage to the next in both our personal lives and our personal journeys and our professional educational development. And I ask that we break through our preconceived identities and roles in healthcare to work as a collaborative team to change the future of healthcare education. Because if we're really going to advance and create the healthcare system we want, then we have to change the way we're educating and teaching the people that work and live in that system. So here's a little bit about the information of the people who are here in this room right now. 23% of us in this room are patients and caregivers. For you, your voice here is needed now more than ever as we work to make healthcare more accessible and more affordable to people and to make healthcare more focused on meeting the needs of patients. The shift to value-based care and patient-centered outcomes will shift medical education. You're no longer a passive voice. You're no longer a subject to be studied. We must recognize that you have expertise that matters and that you have the power to teach us. 52% of you in this room today are healthcare providers and medical educators. So in this role, you're the experts, right? You're often expected to have all the answers. You're the fixers. Fix our healthcare problems. And what's the challenge? Global scientific output is doubling every 9 years. And the uncomfortable truth is, you're often looked to the one as the experts, but you can't keep up with all that information. Nobody can. Medicine and science have become too specialized. Technology has become too advanced for any one person to understand it all. So I ask that we work together this weekend and build bridges with others to cover the gaps we don't understand. 6% of us in this room are registered as students. The future of medical education depends on you. Yet, you're often the underheard voices in the conversations about the future of medical education. You are sometimes told that what worked for your teachers when they were students should work for you. And when those curricula don't fit your needs, you invent your own solutions like osmosis and firecracker and figure one. Because necessity is often the mother of invention. Yet many of those innovations today, they operate in the margins and the shadows of our healthcare curricula. So I ask that we create space for innovation in medical education, to partner and co-create with students. And the rest of us are researchers, technologists, and third parties, like designers. Here in Silicon Valley, you are usually the voices in the room that we hear from the most. You're the ones that are the problem solvers. You turn stories into solutions, data and tools to empower us to take action. You're great at helping us tackle problems like scale, accessibility, personalization. Yet, healthcare is centered around human connection. So, I ask you to connect with the people here this weekend and ask you to consider how technology can bring human connection to medical education and build trust in our relationships within the healthcare system. So we know many of you here today are new to Medicine X. As we grow our global community, I think it's important not only to restate the purpose of our program, but also the terms we use to define the way we see the world. Our purpose as an academic program is to create a culture of health in which everyone is trusted and respected for the expertise they bring, where openness and experimentation is the norm, where people have a personal ownership of health, individual stories have a global impact, and the patient voice and choice is a part of all stakeholder decisions. Inclusivity is an important first step in our work at Medicine X, especially including the underheard voices in healthcare. And we believe that everyone should be respected for the expertise that they have to add to conversations about the future of healthcare. And we call that way of seeing the world everyone included. Our programs are showing that progress in medical science can be accelerated when patients, caregivers, providers, and end users of healthcare are engaged by academic medicine in collaboration and co-creation. And we aren't the only ones co-creating and partnering with patients. The British Medical Journal launched an innovative effort to promote patient partnership in 2014 that includes asking authors to co-create, authors of educational articles, to co-create them with patients. And authors of research papers in the BMJ are required as part of the peer review process to document how they have involved patients in setting the research question, the outcome measure, the design and implementation of the study, and the dissemination of the results. And if they have not included patients, they have to explain why they didn't. Tessa Richards and the late Rosamund Snow, their patient editor, and the editor-in-chief of the BMJ, Fiona Godley, have all done groundbreaking work to advance patient partnership in medical science. And I'm confident that other leading medical journals will follow. Last year, we shared our Everyone Included framework for meaningfully including patients in medical conferences in an article in the BMJ. And we asked other medical conferences to join us in a pledge of patient inclusivity at our fall conference last year. And since last September, we're excited that other organizations from around the world have joined our Everyone Included pledge to include the patient voice in their convenings. So I have an update 7 months later. And this is data from Simpler. So you can see that since we announced our Everyone Included framework for convenings, 172 conferences have pledged to support principles of patient inclusivity in their convenings, with an additional 125 committing actual resources to support patient attendance at their meetings. And we have different levels of support from Tier 1 to Tier 4, and that's a different level of commitment of resources, with 4 being the highest level of commitment of resources. And over the last 6 months, Simpler Analytics reports that over 32,000 conference participants have generated over 168,000 tweets from Everyone Included conferences worldwide. So Everyone Included, as a principle of inclusivity at medical meetings, generating scientific knowledge, it's becoming a global movement. Medical education, and it started right here with co-design with patients in this room. Next, I have a few quick announcements. We have, of course, a fantastic opening keynote from Dan Schwartz, Dean of the Stanford Graduate School of Education. So I look forward to that in just a few moments. But later in the day, please also remember, this is a big reminder, and you'll have the TVs outside in the lobby to also remind you. But later in the day, please remember to return to the plenary hall right here at 1:37 for our midday keynote presentation by Neha Sangwan on diagnosing and treating dysfunction on medical teams, which I promise you none of us can afford to miss. Those of you who've been to Medicine X before know you need to get to your seat early. You may not have a seat if you don't. We start exactly on time, and I hate for anyone to miss a moment of Dr. Sangwan's keynote. Also, please take a look at your badge right now and the incredible artwork that's on your badge. Please join me at 1:57 in the outer lobby. You'll have a very special opportunity during the afternoon coffee break. So there's nothing else going on, and just a coffee break, which is why you can meet the amazing artist who created that artwork, Elizabeth Jameson, our Medicine X e-patient scholar from 2016. Elizabeth actually is a graduate of Stanford. She received her law degree from Berkeley. She was a public interest lawyer for 20 years, and her personal and professional life changed profoundly when she was diagnosed with multiple sclerosis. And she transforms her brain scans into provocative artwork that challenges our conventional viewpoints of illness. If you can make it to her Meet the Artist session, you can ask Elizabeth about her artwork. Or what's less known about her is she had a career in public interest law on Hillary Clinton's task force on national health care reform. And the language that she helped draft has now become part of the Affordable Care Act of 2010. So a lot of diverse talent. Finally, you must stay until the end for the closing keynote of the day, so you may hear from an inspiring man, Eric Brott, who will talk about his work to improve Native American health outcomes and develop a Native American professional training program. So now here's my final call to action for you this morning. I ask that we challenge ourselves over the course of this weekend. We challenge ourselves to let down our guard and be open to the new ideas we see here at Medicine X Ed this weekend. I ask that we challenge ourselves to defer judgment. If you are a self-professed Luddite, someone who doesn't like to turn on the microwave, visit the technology hub in the lobby. Try on the virtual reality headset and experience how artificial intelligence might be used in the healthcare setting, healthcare training setting. And then visit Sid Banerjee in his talk at 5 p.m. And if you're a technologist, and I want you to meet Lois Levine, a medical humanities scholar, and explore humanities and how it can bring together diverse stakeholders in healthcare education and develop a shared culture to improve compassionate communication. And if you're a patient, learn about applying team science principles to support medical education from the Penn State University team. I hear they have chocolate bars. Of course, it's completely unfair of me to point out just 3 talks from the many outstanding presenters from around the world here with us today. My point is simply to push the boundaries of your comfort zone and to show you the diversity of the expertise of the people in the room around you here. So I just can't wait for the rest of the day to begin. Medicine X Ed is such an incredible undertaking. Welcome. The best is yet to come. Thank you so much for being here. Let's get started.